Welcome back from the break. Let's move on to another conversation on health. The Cancer Health Fund is an initiative of the Federal Ministry of Health aimed at providing cancer treatment to indigent Nigerians and strengthening national cancer care. The initiative commenced in 2021 with 6 pilot hospitals, with the federal government appropriating 200 million naira for treatment of indigent cancer patients as part of the fund in the 2024 Appropriation Act. Plans are underway for the establishment of 6 top-tier cancer prevention centers across the country, 6 geopolitical zones. It has emerged, according to data from the Global Cancer Observatory, there were 127,763 new cancer cases and 79,542 deaths in 2022. Interesting data. Joining me in the studio is the Director General of the National Institute for Cancer Research and Treatment, Usman Aliyu. Thanks for coming on the show. Thank you so much.
It's my pleasure to be here.
This is something that we really need to discuss, and that has to do with, cancer still remains at an all-time high in Nigeria, and of course is one of the leading causes of death. And how far have we come in its response, and of course in the country? Is there any progress at all in terms of this awareness?
Okay, so thank you very much for the question. You've started with a brief intro on the incidence of cancer generally. The figures or the rise is not only peculiar to Nigeria. There is increasing trend globally in cancer. And in the year 2022, by the Global Camp, they reported there are about 20 million new cases, and there are about more than 10 million deaths were recorded. I always like to quote a professor, a renowned oncologist, Max Parkin, who reported that the incidence of cancer in the world is going to continue to increase if no intervention is being taken by the countries in the world globally. So, and what is most scary is that he projected that 75% of the increase that we are going to face in the next 2 decades is going to come from low and middle income countries. And we all know Nigeria is part of the low and middle income country. Now, the federal government of Nigeria hit this call because there is war coming to the world. Aside from that of the infectious diseases that we are having, cancer is posing a war to the whole world. Now, the federal government hit this call and established an agency that is purely meant for cancer control in the country, and that is NICRAD. Currently, the agency is in charge of cancer prevention, cancer research, and the treatment. Since the establishment of the institute in 2023, there has been a surge, an increase in cancer awareness campaign in the 6 geopolitical zone of the country. It will amaze you to know that before the advent of this government, there was no center that you can walk into and get yourself screened. No dedicated place in the hospitals or outside that you can go and say, I want to get screened, and then you can be referred easily to. But with the coming of this agency for cancer, this government has funded a pioneer project where each within the 6 geopolitical zones, a preventive oncology center is going to be built. In fact, currently it's ongoing, and we have procured the equipment that are purely meant for cancer screening. 6 centers that we call centers of excellence, one located in each geographical zone. So you see, we have to commend His Excellency Ahmed Bola Tinubu for taking the bull by the horn to actually establish this institute and then pioneer this very applaudable project.
Okay, so, one question just kept ringing in my head. I think that a lot of people, one of the awareness that a lot of people also want to know is what causes cancer. Okay. Because we can say what causes HIV, and these other diseases, but what causes cancer, okay, so that people can prevent themselves from doing all of those things. And just give us an overview of that before we go into the next question.
So, in most cancers that we have currently in the world, there are no cause. Let's say in more than 90% of the cases, there are no cause. We have few that the causative agents are known, like cervical cancer. We know the cause of cervical cancer is a virus, or we call human papilloma virus. And knowing that this human papilloma virus is the primary culprit in the causative agent for this cervical cancer, now the federal government embarked on massive immunization in our young girls, aged 9 to 14. The importance of this is that it has a protracted course. If infected now, it will not manifest within 1 or 2 years. It takes like 10 years to progress. So a girl at 9 or 10 years, if infected, cannot show any sign until later in her lifetime that she will start manifesting with signs and symptoms, and by then it will have reached an advanced stage. So the introduction of this vaccine by the federal government is actually an applaudable event, and it will tell to curtail that. So having said that, other cancers like breast cancers, like cancers of the bones, cancers of the brain, cancers, they do not have a specific cause.
Wow.
But we have what we call risk factors. Risk factors are things that increases the chances of one getting the cancers. After a study that was conducted among people having a certain cancer like breast cancer, they were found to have some things that are similar among them. Yeah. So if you pick those things, those are what we call
the risk factors.
The risk factors. Interesting. And there are many.
Okay, so the Cancer Health Fund has come into play in helping to reduce financial hardship for indigent patients. Tell us how this works so that people can get to know more about it.
Okay, so our Cancer Health Fund is actually an initiative of the federal government under the Federal Ministry of Health. Just like you have mentioned, it was piloted in 6 centers of excellence, cancer centers of excellence, starting with 3 cancers: breast, cervical cancer, and prostate cancer. By now, they are about 1,000 plus have been treated, because of the nature of actually the funding. With the coming in of this government and the establishment of the National Institute for Cancer Research and Treatment, which is an agency purely meant for cancer control, the Honorable Minister for Health, Prof. Ali Pate, now decided that since we have an agency that is purely meant for cancer control, let's move this Cancer Health Fund from the Federal Ministry of Health to this agency for smooth and efficient running of that. So currently it has been moved, and that is this year. We are currently working with the National Assembly people and the philanthropists that we have in the country to improve funding in this fund so that more cancers can be accommodated. And we are in a plan to expand it to virtually all the hospitals in the country, including the private facilities. So currently, we have divided the whole process into 3. The first one we have completed. The first 2 we have identified the feeder stations, which are the PHCs, where if a cancer patient is screened, can be referred to sub-hub. Sub-hub is general hospital that has some component of cancer care services. Then from there, the patient can now be referred to a tertiary hospital, what we call hub, where they can assess the cancer henceforth and get themselves treated.
I want to ask you this question. What are the challenges that you face in implementing the CHF? And two questions in one. The World Cancer Day is just around the corner. What does NICRAT, have in the pipeline to increase better outcomes for patients in terms of diagnosis and treatment and care? Just so that we can.
Okay, quickly. So, thank you. The World Cancer Day is here, and it will amaze us to know that the theme for this year, 2025, is United by Unique. That is, every single individual has a unique way that he can contribute to the care that is given to cancer patient. So it means that care to cancer patient is not just a single entity of care, but it has to be holistic, comprising of virtually the religious component of it, the traditional, involving the caregivers, the families, and what have you. Well, since the inception of the National Institute for Cancer Research and Treatment, I have already mentioned that we have, last year, because we are there about 2 years old now, we have conducted series of cancer awareness programs in virtually 6 geopolitical zones of the country. Now, through that, we hope to, and we are going to continue this year. The essence is to increase awareness. When you increase the awareness of those things that cause an individual to have cancer, it's like you are arming that individual. And when we all know that once people are educated, they can now migrate from that acquiring knowledge to attitudinal change. They will change their attitude, like maybe eating healthy, exercising regularly, stopping utilization of smoking, reducing or stopping alcohol intake, and what have you. So that in the area of prevention. In the area of improving access, aside from expanding the cancer health fund that we did, the Institute now is collaborating with pharma companies through a system that we call NCAP program, Chemotherapy Access Partnership. And through that, we entered an MOU with pharmaceutical companies that provide chemotherapy medication for cancer patients. They are bringing those medication. We collaborate with NAFDAC and the immigration services to reduce, to waive the import costs. And then from there, these drugs are available to the cancer patient at 50%.
Wow.
The original cost. So now you can see that you're getting the original quality drugs from the company at a subsidized cost, so improving access. So we are into that. There has been a lot of researches that we are conducting.
Thank you so much. Thank you. Thank you for the good work you're doing at your agency. Thank you so much. We'll go on a break. When we come back, entertainment and sports. Don't go on over.